Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. The topic is physiological integrity. The healthcare provider is caring for a patient who has septic shock. Which of these should the healthcare provider administer to the patient first? Option A. Antibiotics to treat the underlying infection. Option B. Vasopressors to increase blood pressure. Option C. Corticosteroids to reduce inflammation. Option D. IV fluids to increase intravascular volume. Right answer is Option D. IV fluids to increase intravascular volume. Circulation and perfusion are addressed first, so IV fluids will be started immediately. After blood cultures are obtained, broad-spectrum antibiotics should be administered without delay. Vasopressors are administered if the patient is not responding to the fluid challenge. Corticosteroids may be considered to address the inflammatory-induced vasodilation and capillary leakage. A patient with a diagnosis of lung cancer is receiving chemotherapy and reports nausea and a loss of appetite resulting in decreased food intake. What should the healthcare provider recommend to promote adequate nutrition? Advise the patient to Option A. Eat only favorite foods to increase appetite. Option B. Eat only when feeling hungry. Option C. Eat large meals but less frequently throughout the day. Option D. Eat small meals throughout the day. Right answer is Option D. Eat small meals throughout the day. The patient may not feel hungry due to chemotherapy-induced nausea, but should be encouraged to eat even if not hungry. Encouraging the patient to small meals frequently throughout the day can help avoid nutritional deficiencies and improve quality of life. Chemotherapy can cause changes in smell or taste. Aversion to favorite foods can result. A female patient complains of abdominal discomfort. Watery stool has been leaking from her rectum. This could be a sign of Option A. Fecal impaction. Option B. Constipation. Option C. Bowel incontinence. Option D. Diarrhea. Right answer is Option A. Fecal impaction. Fecal impaction can be serious. When constipation is not resolved, stool becomes hardened and unable to pass. Liquid stool may pass around the impaction. Patients may complain of feeling bloated, having the urge to push, nausea or vomiting, not wanting to eat. The impaction may need to be manually removed. Patient education should include increasing liquids and fiber, as well as regular physical activity. Which of these assessment findings should the healthcare provider expect to identify as an early clinical characteristic of multiple sclerosis, MS? Option A. Clonus. Option B. Vision loss. Option C. Muscle atrophy. Option D. Dementia. Right answer is Option B. Vision loss. MS is an inflammatory demyelinating disease of the central nervous system. Demyelination will cause slowed conduction and eventually loss of function. Vision loss and eye pain, optic neuritis, are early symptoms of MS due to inflammation of the optic nerve. Dementia is uncommon and found only in severely affected patients. Clonus, rhythmic contractions when a muscle is stretched, is a sign of nerve damage which may be seen as MS progresses. Muscle atrophy is also a later sign of MS which is cause. An unresponsive patient with diabetes is brought to the emergency department with slow, deep respirations. Additional findings include blood glucose 450 mg/dl, 24.9 mmol/L, arterial pH 7.2, and urinalysis showing presence of ketones and glucose. Which of the following statements best describes the underlying cause of this patient's presentation? Option A. Nocturnal elevation of growth hormone results in hyperglycemia in the morning. Option B. Hyperglycemia causes oxidative stress, renal dysfunction, and acidosis. Option C. Hypoglycemia causes release of glucagon resulting in glycogenolysis and hyperglycemia. Option D. Lack of insulin causes increased counter-regulatory hormones and ketone release. Right answer is option D. Lack of insulin causes increased counter-regulatory hormones and ketone release. DKA prevents glucose from entering the cells. The body releases and counter-regulatory hormones and undergoes lipolysis in an effort to increase glucose, resulting in hyperglycemia, ketogenesis, and acidosis. The healthcare provider is caring for a patient on a ventilator with an endotracheal tube in place. What assessment data indicate the tube has migrated too far down the trachea? Option A. Increased crackles auscultation bilaterally. Option B. Decreased breath sounds on the left side of the chest. Option C. Low pressure alarm sounds. Option D. A high pressure alarm sounds. Right answer is option B. Decreased breath sounds on the left side of the chest. If the endotracheal tube is inserted too far, it often goes into the right main stem bronchus. Air will then be delivered to the right lung and not the left. A low pressure alarm indicates a disconnection or a leak in the circuit. A high pressure alarm can mean an obstruction, such as a kink in the tubing or a need for suctioning. When caring for a patient with a cardiac dysrhythmia, which laboratory value is a priority for the healthcare provider to monitor? Option A. Burn and creatinine. Option B. Sodium, potassium, and calcium. Option C. PT and INR. Option D. Hemoglobin and hematocrit. Right answer is option B. Sodium, potassium, and calcium. Because abnormalities in sodium, potassium and calcium levels are likely to affect depolarization and repolarization of cardiac cells, it is most important for the healthcare provider to monitor these laboratory values. Burn and creatinine levels are always important to monitor when giving any drug, not only anti-dysrhythmia drugs. The PT and INR will be important for patients who are on warfarin, Coumadin. When evaluating the arterial blood gases, ABGs, of a patient with a 20-year history of chronic bronchitis, which of these would the healthcare provider expect? Option A. Respiratory acidosis, compensated. Option B. Respiratory alkalosis, uncompensated. Option C. Metabolic alkalosis, compensated. Option D. Metabolic acidosis, uncompensated. Right answer is option A. Respiratory acidosis, compensated. Chronic bronchitis diminishes airflow during expiration, trapping carbon dioxide, CO2, in the lungs. The increased CO2 lowers the arterial pH, causing respiratory acidosis. The kidneys compensate for the chronic acidosis by conserving bicarbonate. This keeps the pH in a low normal range, resulting in compensated respiratory acidosis. A patient with chronic hepatitis C is scheduled for a liver biopsy. Before the procedure, the nurse checks the most recent lab results. Which of the following laboratory tests does not assess coagulation? Option A. Prothrombin time. Option B. Hematocrit. Option C. Partial thromboplastin time. Option D. Platelet count. Right answer is option B. Hematocrit. Prothrombin time, partial thromboplastin time, and platelet count are all included in coagulation studies. The hematocrit does not assess coagulation, it reports the percentage of red blood cells, RBCs, in the blood. When a drug's effect is increased after a second drug is given, this interaction is called option A. Potentiation. Option B. Absolution. Option C. Antagonism. Option D. Synergism. Right answer is option A. Potentiation. Potentiation is a type of drug interaction. Potentiation occurs when two drugs are taken together, and the action of one drug increases the action of the other, causing the pharmacologic response to be greater for one of the drugs. Thanks for watching. If you like our video, then do like, comment, share. Subscribe our channel for regular updates.